The recommendation is written to stop providing pediatric surgery. Currently, our pediatric surgery program consists of ear, nose, and throat surgeries being done on children. This is usually tonsillectomies or tubes being put into their ears. And our dentists, our local dentists, do a lot of dental surgery, fillings, and a lot of dental work on kids. And these are kids that can't be done in the office setting. They have a lot of work that needs to be done in a single setting, or for medical reasons or anxiety reasons. These kids need to be done asleep in a proper operating room. Also included in our pediatric surgery are the occasional general surgery patients. So these are kids that need their appendixes out on an emergency basis. These are kids that have very common and straightforward issues that can be corrected surgically. At this point, our surgery program is not equipped for specialized pediatric surgery, and a lot of that stuff is very appropriately sent down to larger tertiary centers for specialized pediatric surgeons. Right now, the work that's being done is very appropriate for our setting. We're not doing things that should be done somewhere else. Our surgeons are highly trained in the services that they provide. The recommendation to stop providing pediatric surgery does not serve our community. If we were to go ahead and implement this recommendation as it currently says, this would mean that a lot of patients would have to travel farther distances for their care. Any of the kids needing the ENT surgery would have to travel to Barrie. And the surgeon who provides that service also runs a clinic in Penetanguishene, which also makes the initial consultation and follow-up care more convenient for these families. All of that service would have to be moved down to Barrie as well. And for a lot of these families, travel is a big barrier. So whether that means these kids wouldn't be getting surgery or would, with big sacrifices from their families to accommodate the extra distance, that remains to be seen. With respect to the dental surgery, having spoken at length with the chief of the dental department, these kids, if they don't get care locally, they just don't get care. They don't have the resources to travel. This is a real disservice to the kids in this community who need their teeth looked after. It's a big part of self-esteem. It's a big part of their nutrition and their growing up. And to not be able to provide this care locally is really impacting on their ability to receive any appropriate dental care at all. The rest of the general surgery patients, if you come in with an emergency and we're not able to provide pediatric surgery, it means those patients will be transferred out and likely to Aurelia, which again, the distance is very inconvenient for many families, especially if they have other children that need to be attended to at home, or if families have limited means of transportation. Elective surgeries again would have to be sent elsewhere for further inconvenience. The bigger picture of eliminating pediatric surgery is a loss of a skill set of our operating room team. And it's not just the surgeons that we're talking about. The anesthetists are highly skilled in managing pediatric airways, and that's important because when kids come into our emergency department that need emergency access to help with their breathing, if they're having an anaphylaxis allergic reaction, if they're having a bad asthma attack and need assisting with their breathing, our anesthetists are the ones that our emergency department relies on to help with these complicated and highly critical airways. If our anesthesia team is not getting regular exposure to practice on normal kids during routine surgeries, their skill set is lost, and in the emergency time, that skill set is critical. Our nursing staff is highly trained and deals with kids all the time. And again, the less you deal with a problem, the less comfortable you become with it. And so for those emergency situations where we would be losing our ability to handle those patients in a safe manner, maintaining pediatric surgery at Georgian Bay General Hospital is not just about providing care to our patients on an elective basis, but also about maintaining a critical skill set should they be needed in an emergency.